still effective?
So the question is a little bit more about the weight gain. Is there an average number? And if your calories are stable, do you still gain weight? Sarah, what's the average weight gain in your
The average
practice?
is 25 pounds.
Not a small number. Now, here's the problem with the second part of your question, if you maintain the same calories. So I do have people that absolutely say, I am not eating any differently, and they're still gaining weight, so that's a possibility. But we have to be very careful with our understanding of the statement, I am not eating differently, because unless we actually write it down and measure it, we are unaware of the subtle buildup changes in our diet. And there's so many factors that can lead to change in diet. When you're feeling better, you're going out to more restaurants, or you're able to get up and help yourself to the sweets in the kitchen easier. So it is really very important to write down and have that diary to know what you're eating, but equally important to keep that exercise program going to help with it.
On weight gain, I have trouble gaining weight, so if I had the DBS, you think I'd be able to gain some weight?
So a very good question. So her question was, I have trouble gaining weight. And you're not alone. Many people at DBS have trouble keeping the weight on. So they have the opposite problem. The first thing I say is do not go to DBS with the goal of weight gain. I would not use that. Well, some people do. Some people do. They have certain goals that they want, and that's why they're going.
Well, I thought because I wouldn't tremor so much, I might be able to.
And that is indeed a possibility. Not always, but it is a significant enough factor. A majority of patients are noticing weight gain.
When is it time to have a discussion with our doctor about DBS?
So if you have Parkinson's, when is it a time to have a discussion? Your medicines are working. When you take your medicine, you're still noticing an improvement in how you feel. But you're starting to notice it wear off. You're looking at your clock. My next dose is not due for a period of time. Things are getting worse. Or you're having extra movements, dyskinesias. Sometimes people will actually think of DBS a little bit earlier in the progression of Parkinson's disease, especially if they have tremor that's bad. Very disabling tremor that bothers you a lot does not always get better with the medicines that we have to give you. So you might consider it earlier with that specific goal in mind. I want tremor to get better. And who is next?
I have a quick question, please. With essential tremor, what is the age limit for DBS surgery?
Well, for any condition, what is the age limit? And I won't be able to give you a number. We've had experience with patients over the age of 80. I think we even had a patient that was 88 who did extremely well. We've had patients over the age of 80 that have not done well. And the problem is number one, we don't have enough patients over 80 that have gone to surgery. Number two, it's not just how old you are. It's how healthy you are. And so we don't have that number. So I would say, rather than throwing out a static number, it's better to just have that conversation with your doctor. Is it right for me at my age? If you have significant heart problems, if you have serious diabetes, if you have other medical conditions and you're 75, it might be not the right thing for you. But again, we can't generalize, and this is where everybody's an individual. The research, though, we do not have good research that says people over 75 do have this percentage of success or improvement. In the back. You're welcome.
Traumas to my head. Okay, I've had a number of traumas to my head, hit my head real hard. How do I tell if there's damage done?
Did I hear correctly that you've hit your head, and how do you tell if there's damage? Well, a couple things. How do you tell is there's a change in how you feel. Your DBS was controlling something that now has come back. Or you're feeling some buzzing or some shocking sensation or some sensation around that area. And then the third thing is your programmer checks it. And your programmer has ways to interpret and what we call interrogate the system and look at the numbers to tell you everything's A-OK or not.
Does that answer your question? Okay.
I was wondering about DBS.
I'll get you next.
Oh, I'm sorry.
That's okay.
Oh, it's me.
Yeah, you go and then I'll get back.
I was wondering how the connection between the DBS and does it help like stiffness and slowness?
So it does. So DBS does help the stiffness and the slowness, but again, you still want to use the general rule of thumb if it gets better for medicine. Okay? And now, right behind.
How long have they been doing this?
So when was DBS FDA approved for tremor? 97. I remember doing research trials when I was a fellow in 96. When did... Yeah, actually, here we go. Dr. Young is one of the pioneers of DBS.
Well, DBS actually started in Europe in the 1960s, and I started doing it in 1978. From about 78 until about 1990 or so, it was done for chronic pain. And as Dr. Giroux said, in the early 90s is when it was first approved for essential tremor, and then subsequently for Parkinson's and dystonia. So it's been around a lot longer than people realize. People think, oh, this just happened a few years ago. 40 plus years of experience.
Thank you. So Sierra, you're going to have to help me with who's next.
Yeah. Is there new data that says DBS slows progression of Parkinson?
That's a hypothesis. Can DBS slow progression of Parkinson's? And the idea is the subthalamic nucleus that's being stimulated is also a nucleus that is modified with chemical neurotransmitters that can have what we call excitotoxic properties. And so if we can reduce the tone and the firing of that nerve cell, it might be good for the neighboring nerve cells. So an active area of research, and it is that possibility is there, but we don't have that, that affirmation yet. Because there's a problem with doing these studies, and sometimes it's a big step between the laboratory and the person, is even if you've had DBS and you turn it off and you say, I haven't gone back to where I was before surgery, the brain doesn't work that way. There are immediate changes, but there are long-term compensatory changes. And just like when you stop a medicine and you wash the medicine out of your system, it takes many weeks to go back to where you were without medicine, not just a few weeks. So it's really hard to do those studies, and we need good ways to measure. And without the good ways to measure the disease changes, it's hard to answer those questions.
Dr. Giroux, could you comment on your patients that have had Parkinson's 20 years with and without DBS? How do you see those patients different? Those that have had 20 years of Parkinson's with and without DBS, how do they differ?
That's a loaded question. I knew I should have kept to the audience for I saw her raise her hand and I'm thinking, I don't want to go there. So again, it's not one size fits all. So you've had Parkinson's for 20 years, you've either had DBS or you haven't had DBS. The first thing is, as the disease progresses, the problems that you're going to have with or without disease, with or without DBS, are going to be there. The balance issues, the speech issues, the swallowing issues, they're going to be there. But the other problems, like the dyskinesias and the fluctuations, are better. People manage better throughout the many years. But you still can have those other problems that creep in there in both situations. But if you've had 10 years of DBS moving well versus I have on-off fluctuations, I'm on 50% of the day, then I'm on 40% of the day, then I'm on 30% of the day, so you're barely moving, irregardless of the Parkinson's, you're going to feel, do, and be very different, right? And so there might even be you might not even live as long because of all the other issues associated with it. But you have to look at how the DBS would change your life with the on-off fluctuations and dyskinesias in that 10-year period, but know that the other things are still going to be there. Not sure I answered the question very well.
Is 10 years the lifespan on DBS?
No, we don't know what the lifespan is on DBS, and we are collecting information and data and research studies out greater than 10 years and 15 years. The thing is, what DBS treats and what can get people into trouble and feel not so good at the 15 years are two different things. So let's say you got DBS 10 years ago. 10 years, 15 years later, it's still treating your tremor. That's good. It's still working. But the things that DBS cannot treat may be there now and might be more of your problem. So you might interpret it as the DBS not working, but the DBS is working.
Hi. I have both Parkinson's disease and dystonia disease. Would the DBS take place of the Botox shots I have to get every 3 months, which I'm thankful for, which are very painful though?
So Botox, botulinum toxin injection, is a treatment for dystonia, especially if dystonia is in a particular area, a focal area of the body, so maybe the neck or the hand or the foot, and you can get injections to relieve that muscle contraction. And after DBS, that dystonia can get better. So again, the answer is it depends. There's many times, what I see is, in my experience, what I saw is people went to DBS and then stopped having the Botox injections, which often is a good thing and often the appropriate thing. But also what I saw is people still didn't consider the combined benefit of the two if they still had problems with dystonia. So dystonia a lot better, but still had problems.
The Botox is wearing off. It's not going 3 months. And with Parkinson's, that medication that wear off of that also.
Yeah, so Botox as a therapy for dystonia doesn't last. And we usually do it about every 3 months. And the worse the dystonia, the earlier it's going to wear off.
My whole lifestyle.
Yeah. So again, I can't say yes or no, but it is possible that DBS, because it can improve the dystonia, can reduce the need for Botox. So DBS still can, what we know, still can treat the symptoms that the medicine can treat over time. But again, as it gets worse and worse, you still might have some decline in those other symptoms, and chances are you still will. But it's still effective. But your medicines are still effective over time. It's just that they're lasting a shorter and shorter period of time. So the idea that medicines wear out is not really an accurate idea, but it does get shorter and shorter.